Earlier this year, a man in New York followed a diet plan generated by an AI. It told him to cut out sodium completely. Within weeks, he was hallucinating, paranoid, and ended up with a health condition doctors haven't seen in over a century. That's the promise and the peril of artificial intelligence and health. It can guide us, or it can mislead us in dangerous ways. Today, let's explore both sides of this revolution in lifestyle medicine. On the bright side, AI is opening doors we couldn't have imagined even 5 years ago. Take Fitbit, for example. Now powered by Google's Gemini AI, it's turning your wristband into a personal health coach. Instead of just counting steps, it now studies your sleep, your workouts, even your long-term habits, and gives you personalized nudges toward better choices. Would you trust your fitness app to guide your daily health decisions? Another hopeful story comes from the Cleveland Clinic. Researchers tested an AI-driven coaching system for people with type 2 diabetes. It combined wearable sensors, real-time feedback, and lifestyle guidance. The results were remarkable. Patients saw better blood sugar control, lost weight, and many even reduced their dependence on medication. That's a glimpse of how AI could help us shift from treatment to prevention. And then there's Bill Gates, who just launched the Alzheimer's Insights AI Prize. It's a $1 million challenge to build tools that can unlock hidden patterns in brain data and then make them free for researchers worldwide. If successful, it could speed up the fight against one of the hardest diseases of our time. But for every bright story, there's a shadow. This November, the FDA will meet to review AI mental health devices, things like virtual therapists and chatbots. They promise affordable access to care, but if they're wrong, the risks are personal: misdiagnosis, bad advice, or a false sense of security. Should we trust a chatbot with something as sensitive as our mental health? And we can't ignore the diet disaster I mentioned earlier. A man took AI advice literally, followed a sodium-free plan, and ended up in the hospital with hallucinations and paranoia. This isn't just a bizarre story, it's a warning. AI doesn't yet understand context the way a trained clinician does. What works in theory can break a human body in practice. Finally, there's the issue of data. Many AI health and lifestyle apps collect enormous amounts of personal information. That data can be used to tailor better advice, but it can also be sold, shared, or misused. Better health insights might come at the cost of your privacy. So, where does that leave us? AI in health is exciting, but it's also risky. The difference lies in how wisely we use it, balancing curiosity with caution. Are you more excited or more worried about this future? Let me know in the comments. And if you found this breakdown useful, hit like, subscribe, and share it with someone who's curious about where health is headed. Because AI won't replace lifestyle medicine, but it may become one of its most powerful tools. The real question is whether we shape it or let it shape us.